Hi, this is Dr. Jennie Byrne. I'm a psychiatrist at Cognitive Psychiatry of Chapel Hill, and I'm here today to talk a little bit about adult attention deficit hyperactivity disorder, better known as ADHD or ADD. So I see a lot of this in the office. I get a lot of questions about it, but today I wanted to focus on individuals who do have a diagnosis of ADHD and maybe are wondering what they should do to help manage it. So I guess I would start by saying there's many different ways to treat ADHD. And as you may have experienced, some of ADHD isn't all bad and may actually help you in certain situations. But when you're having difficulty, there's different treatment options. You've probably heard a lot about medication options, and these are some things like Ritalin or Adderall. They get a lot of press. You hear a lot about them in the media. So I'm not going to talk about them too much, except I will say there's a lot of debate about them. One thing I'd like you to know about medications is that there are non-stimulant medications for ADHD as well. So if you don't want to take something like a Ritalin or an Adderall because it's a stimulant, but you still think medicine could help you, there are other options out there. So some of the names of the other medicines are Wellbutrin, Strattera, Intuniv, Guanfacine, Clonidine. These are some of the different types of non-stimulant medicines. But I'd like to spend a few more minutes on ways to cope with ADHD that are not medication focused, because I think most of the emphasis in the press these days is on medicine. And it's very important for you to know that there are non-medication things you can do to help your ADHD. So, what can you do? In terms of your day-to-day life, there are some changes you can make which will probably help. Number one is sleep. So when I say sleep, I don't mean 8 hours of sleep a night. I mean routine sleep schedule. So the amount of sleep you get is important, but more important is staying to the same sleep schedule. ADHD is infamous for having altered sleep patterns. People tend to stay up all night, be tired the next day. This is very common. So setting up a routine with a regular bedtime and a regular waking up time can help quite a bit. One thing to note about sleep too is try to stick to the same routine on the weekends and vacations that you do during the week. And most people think this is crazy, you know, on the weekends they want to sleep till noon. But if you sleep till noon on Saturday and Sunday, it will tend to create real problems when you want to get back onto your routine Monday. So sleep is one thing you can definitely work on. Number two, exercise. I know you hear this over and over and over about how exercise helps everything, but all studies show that it really can help with ADHD. Probably if you're someone that has a lot of the internal restlessness or the hyperactivity associated with ADHD, exercise will help you burn off some of that extra adrenaline, that norepinephrine, and make you feel a little bit calmer and have a little less internal restlessness. So again, it's not that, you know, you go out and run a marathon once every 3 months. When I say exercise, I mean regular structured exercise, but it doesn't have to be, you know, hours at a time. It doesn't have to be a fancy gym. It can be 20 minutes every day, you know, in your living room. It's more the consistency of the exercise rather than the type or the duration that's important. So if you can kind of coordinate that with the sleep and somehow coordinate your sleep and exercise, those are two really important things. Another important thing is your environment. People with ADHD tend to have chaotic environments which kind of mirror some of the chaotic thought processes. There are some good books out there on how to do this. One of the books I like is called ADD Friendly Ways to Organize Your Life. I like that one. It's very easy to read. But the basic idea is to structure your environment so that you will be able to function optimally. So there's a little mantra that we say, which is everything has a place and everything has a place and everything in its place. So basically, everything in your house should have a place that's designated just for it, and you should always put that item in the place. Classic example of this is the keys. Okay? What do you do with the keys? You need to have something in your house which is a place that your keys go. Ideally, it's by the door. It can be a hook. It can be a shelf. It can be a basket. It can be a bag. It can be anything. But keys should always go in that place, and they should never go anywhere else. So that idea kind of taken to the rest of the house, the structure of the environment can help quite a bit. So those are just 3 things that you can do on your own to see if they help manage some of the ADHD symptoms. If you feel like this isn't really good enough, or you've tried a lot of self-help and you just get frustrated because maybe you have trouble getting started or trouble getting finished, which is a common ADHD issue, then you might want to seek more professional help. And there are things like coaches who are kind of like a cheerleader. They meet with you or talk with you frequently to keep you on track. Or if you have a lot of negative thoughts and feelings about your ADHD, something called cognitive behavior therapy can be very helpful. And then finally, there's group therapy. Some people really enjoy being in a group of other people who also have ADHD issues. So kind of to summarize, treatments for ADHD, they're the medicines, which you hear a lot about in the press, and there's stimulants and non-stimulants. There are things you can do on your own, like sleep, exercise, and structuring your environment. And then if you feel like you still need some professional help, there are things like coaching or cognitive behavior therapy, which can help. So I see a lot of ADHD. I'm happy to answer any questions you might have. You can contact me at the information below, and I wish you good luck. Bye-bye.